Hello, my name is Natasha Mendez and I'm going to do a peer review on Phoenix Children's Hospital. To begin, the reason for the policy is to provide a mechanism that enables the medical staff organization and the hospital board of directors to assess the professional performance and competence of providers privileged by the medical staff. This includes conducting professional practice evaluations and using the results, assess assessments and evaluations to improve the medical competence, medical practice, and patient care. There are four main goals of the policy. One of the main goals is to identify any existing opportunities for practice and performance improvements of individual practitioners, provide feedback, and develop plans for improvement and correction to improve the quality of care provided by the practitioners. Phoenix Children's Hospital has two types of peer review processes. The first is called the Focused Professional Practice Evaluations, or FPPE, or Focused Review Process. It is used to assess current competencies of privileged providers and competencies for newly requested or granted privileges. This process may also be used to investigate concerns arising from ongoing professional performance evaluations, individual case review, or trends in practitioner performance. The second peer review process is called Ongoing Professional Practice Evaluations, or OPPE, a mechanism whereby the medical staff identifies professional practice trends that affect quality of care and patient safety on an ongoing basis. The ongoing process continually evaluates individual practitioners for performance and competence-related issues using multiple sources of information. Both processes are reviewed by the peer review committee. Starting with the OPPE review, the committee members are not blinded to the provider's identity. The data collected includes review of the operative and clinical procedures performed and their outcomes, patterns of blood and pharmaceutical usage, length of stay, and patterns, morbidity and mortality data, providers' use of consultants, department-specific process audits or guideline audits, and compliance with hospital and medical staff rules and policies. The OPPE is a continuous process and is evaluated on a regular basis. When the data suggests unfavorable behavior performance, then the peer review committee may recommend further evaluation of the FPPE. Next, the FPPE, or Focused Professional Performance Evaluations. This process is more detailed and complex. To summarize it, this process is utilized for several different reasons. Some of the reasons are to evaluate the conduct, performance, and competence of the practitioners holding privileges through Phoenix Children's Hospital. Next, when concerns arise regarding the practitioner's clinical performance, or when the practitioner has been documented to display acts of demeanor or conduct which may be detrimental to the patient's safety or the delivery of care, the patient, or the delivery of quality care within the hospital, unethical or contrary to the medical staff bylaws, the rules and regulations, or reliable professional standards. The FPPE is used in circumstances when the peer review committee needs additional information to clarify issues raised during their deliberation. And most importantly, a focused review shall not be construed as nor shall it constitute as an investigation. The review committee will be composed of 5 members, 3 from which the practitioner's department, 1 is the chair from the peer review committee, and 1 is the president of the medical staff. At least one of the 3 practitioners must have similar clinical privileges as the practitioner. 1 or more external reviewers may participate. The practitioner being reviewed is allowed to participate in the process. The committee decides the level of involvement. Several steps later, the committee reaches their conclusion with recommendations which goes into the practitioner's quality profile. The practitioner has 5 business days to receiving the letter with the recommendations from the committee to provide the input from the MEC for its considerations. Lastly, Phoenix Children's Hospital also has an entire confidentiality policy relating to this policy for protecting its practitioners. Next, I will discuss the AANP, or American Association of Nurse Practitioners, values and beliefs. I could not find an outline model of their peer review process for nurse practitioners, but instead I decided to look at their core values and beliefs. The AANP's mission is a full-service national professional membership organization for NPs of all specialties, is to lead NPs in transforming patient-centered healthcare, with a vision statement of high-quality healthcare for all by the patient's provider of choice. The AANP also has 5 core beliefs: integrity, excellence, professionalism, leadership, and service. Attributes such as reliability, accountability, meeting and exceeding expectations are just a few to name. These 5 core values are all factors that the peer review committee at Phoenix Children's Hospital look at during their review processes. As I can see, the AANP's core values are also the core values that Phoenix Children's Hospital looks for in their practitioners. Last, I will discuss the regulatory organizations and how they help to help or impede advanced practice nurses. In the state of Arizona, the Arizona State Board of Nursing is our regulatory organization for nursing. As advanced practice nurses, the State Board of Nursing, I feel, is here to help us and guide us. On their website is a description of nurse practitioners' roles and functions. More specifically, the standards related to registered nurse practitioners' scope of practice is available. Additionally, the board defines delegation to a physician or medical assistant by a nurse practitioner. It states that a registered nurse practitioner shall refer a patient to a physician or another healthcare provider if the referral will protect the health and welfare of the patient and consult with the physician and other health providers if the situation or condition occurs in a patient that is beyond the registered nurse practitioner's knowledge and experience. Also on the board's website is information on prescribing and dispensing authorities, including drugs and devices and prohibitive acts. Next is general requirements for education. Last, the board has a section dedicated to the process of disciplinary action if something should be taken against your license. This concludes my presentation today. Last, I would like to mention, according to Phoenix Children's Hospital, a peer is defined as a practitioner who has similar expertise in the appropriate specialty area.